Hi, my name is Asong Jingwa. I'm a PhD student in social work in University College Cork, Republic of Ireland. I'm also a social work practitioner. I'm here today to talk to you about my PhD research in relation to cultural and ethnicity within the Irish Early Intervention Services. I'm going to start by sharing my screen with you so that we can talk through the slides. So, like I said, the title of my PhD is Culture and Ethnicity: Critical Factors in Irish Early Intervention Services. This is an ongoing PhD research. The data is in, the analysis are in, and it's just in terms of fine-tuning the lecture review now and the analysis chapters. So it's still work in progress. But when we are talking about Ireland, what is the background of Ireland? So Ireland moved from immigration in the past to immigration in the 1990s from different parts of the world, including Africa. This brought opportunities in terms of enrichment for all inhabitants. It also brought challenges in terms of integrating immigrants at an individual and group level. So, and it created a need thus for this cultural diversity created a need for culturally sensitive service provision to people from ethnic minorities within Irish Early Intervention Services. And when we talk of Irish Early Intervention Services, we refer to disability services that work with children between the ages of 0 to 6 years, children with intellectual disabilities, children with sensory, and children with physical disabilities. And these teams will comprise of social workers, will comprise of occupational therapists, will comprise of psychologists and physiotherapists and other clinical professions. So what are contemporary studies saying in terms of this research? Studies in the USA and Canada indicate discrimination, oppression in power relationships in accessing disability services, and immigrants not being provided with necessary services in an appropriate manner. Is this the case in Ireland? This study sets out to investigate the above, given that there is no current literature on the experiences of African immigrant families of children with disabilities accessing Irish Early Intervention Services. So this is a qualitative study of the lived experiences of African immigrant parents of children with disabilities in relation to access and utilization of Irish Early Intervention Services and ways in which this could be enhanced. The research investigates how cultural perceptions affect the way African immigrant parents of children with disabilities approach and relate to early intervention services in Ireland, and how the idea of cultural competence may be useful in understanding how professionals working in early intervention services understand and work with African immigrant parents of children with disabilities. So the method used in this research is semi-structured individual interviews of African parents and healthcare professionals, and also in-depth review of related literature. Thematic content analysis is also applied to analyze the data. So what are the findings telling us? Findings highlight tension and ambivalence in the relationship between parents and professionals based on different constructions and understandings of disabilities. First of all, parents would disclose that they construct their child's disability based on spiritual connotations and on religious affiliations, while professionals would disclose that they understand children's disabilities based on their medical background in terms of deficiencies or in terms of medical diagnosis. So why parents see their child's disability as maybe a curse or retribution for past sins, or maybe a gift to a child as a gift to them from God, because some parents will say they consider these children as special gifts from God to special people that God considers them fit to take care of these special children. But most parents will consider it as a curse. Meanwhile, professionals will see it from a different perspective. So this creates tension in the relationship between parents and professionals. In terms of service expectations, while most parents will expect a cure for their child, professionals will try to explain to parents that there is no cure for most of these disabilities. It's more about working with the child to be the best that they can within their disability. And in addition, parents experience identity issues. First of all, when a mother is expecting a child, they are expecting a normal child. They have plans, they have dreams for this child, and they have things that they would like to do with this child. They have expectations, very high expectations for this child. But when they have a child with a disability, especially parents of African immigrant background, parents who took part in these studies, and these parents who took part in these studies will have come from Cameroon, or some will have come from Nigeria, some will have come from South Africa, and some will have come from Somalia. So overall, there were 10 parents that took part in this research, and parents will have said in their home countries, children with disabilities are stigmatized, they are abandoned, they are put beside the water to die, they are neglected, they are not cared for, and they are looked upon as people who should not even be existing within the society. So having a child with a disability creates a lot of stress for parents, because first of all, while they are here in Ireland, they crave their traditional support mechanisms, their parents, their siblings, their extended relations, their friends. They want to be where this support is. But with this stigma back in their home countries, they can't be in that place because there is stigma, and then there are no resources. There are not enough resources to care for children with disabilities. Meanwhile, in Ireland, there are resources to care for children with disabilities, which parents very much appreciate, and there is more of a positive outlook on children with disabilities. So there's also discrimination experienced by parents. There's overt and there's covert discrimination. Overt discrimination in terms of parents being told, oh, your child is strong, your child is coming from an African background, and African children are usually more resistant to diseases than other children. This would be a case in point would be some parents, a father and a mother, who disclosed to me during interviews that their child was born premature and their child had to spend a considerable time in hospital. But while their child was in hospital, their child shared a ward with other Irish children. When there was a new admission and there was a need for beds, their child would be the first to be approached, to be removed from that room and put into another room which was not suitable for her needs. And their child would come back with infections. Other Irish parents will not agree for their child to be put in that room, and their wish will be respected. But when these African parents insisted that their child will not go to their room, their wish will not be respected. So this was overt discrimination that needs to be challenged within the system. The covert discrimination then is in relation to parents not having knowledge of services. It's in relation to services being geared around Irish norms and not suitable, and not targeted to meet the needs of immigrant families. So this creates discrimination covertly in relation to these parents. So what are the recommendations that parents will bring up? Parents would say they would like their opinions to be valued more, because this is their child and they spend more time with their child and they know what they are going through with their child. Parents will also appreciate more information in relation to services out there and in relation to knowing what to look out for in case their child has a disability, whom to contact and when to contact the person, and how to follow up in relation to services. Parents will also say they would like professionals to be culturally aware, to work with them on a one-to-one basis rather than work with them dealing with in relation to stereotypes and trying to build a picture of them based on what their experiences with other families, African families of children with disabilities. Parents will also recommend better coordination of services and allocation of resources. Meanwhile, they will also recommend self-advocacy for parents of children with disabilities. One parent pointed out that most African parents, they don't seek advice from the appropriate services. They seek advices from other parents who do not have adequate knowledge, and they go by this information, which is second-hand or third-hand or fourth-hand information, and it ends up not helping them. And when they approach services and they get a negative experience, they don't feed back to these services in terms of their negative experience for the amelioration of services. they complain to their African friends who cannot do anything to help them or help other families. So these are the recommendations from parents to other parents. So the emerging themes that come up from this work is in relation to the parent transformation process in terms of meaning reconstructions. So as parents try to come to terms with how to live with their child's diagnosis and the choices available to them, the processes of meaning making, image making, and choice making are activated. There is also the issue of intersectionality, because parents have different factors that combine and intersect to build up their experiences to make it either a positive or a negative experience. So first of all, these parents are from a different race. They are immigrants. They are coming from a background where disability is stigmatized. They are living in a place where they don't understand the system. They don't have a history of the system. They need support. They are experiencing social isolation within the system, because parents will have complained that some members of the African community within Ireland will speak negatively of their children with disabilities, will make some very disrespectful remarks about their children with disabilities, causing them to withdraw from such communities. So all these things intersect to form a lot of stress for parents, and double stigma as put forward by Albright in terms of parents experiencing the stigma of having a child with a disability and then being in a system that they don't understand. All of this compounding to form a lot of stress for parents. So parents have said they experience feeling stuck in Ireland. And why do they feel stuck in Ireland? They feel that they cannot go back to their home countries because of the negative perceptions and attitudes towards children with disabilities in their home countries. And in addition to that, there are not enough services to cater for children with disabilities. Meanwhile, in Ireland, there's a more positive approach to children with disabilities, and there are services to cater for these children. But then why the word stuck? Stuck in relation to the fact that while in Ireland, they miss their traditional support mechanism. While in Ireland, they do not understand, they don't have a history of the system. They don't feel understood by professionals. Although they very much appreciate, there's a strong sense of appreciation coming from parents in relation to the services that they are receiving in Ireland, and in relation to the positive attitudes towards their children with disabilities overall. But when parents were questioned further, they would have explained that they do not feel that services are culturally sensitive. They feel that services are directed, are geared and built around Irish norms rather than being amended or being targeted to meet the needs of specific cultural needs of immigrant families. So while parents are complaining of culturally insensitive service provision, professionals are complaining of limited resources. For example, in relation to time, professionals will say that they need time to build rapport with parents. They need time to understand parents, to get to know parents, to know what is meaningful for them, to be able to make services more meaningful for these parents. Professionals will say they have huge caseloads. They need more staff to be able to have more time to work with parents. Professionals will complain that they don't have enough cultural competence training to work with immigrant families. Professionals will also complain that there's a lot of bureaucracy involved and that they are not being encouraged to work one-on-one with parents to build that long-term relationship with immigrant families. So all of this boils down then to look at organizations. How can organizations change in terms of service provision so that service provision then can be culturally sensitive to the needs of immigrant parents? So this research that confirms findings by other studies that healthcare professionals do not feel adequately equipped to address the needs of families from diverse cultural backgrounds and depend mostly on stereotypes and generalizations to inform their practice. In order to overcome this barrier, here and others and his co-authors suggest the need for a move away from relying on assumptions and expectations towards the conduction of further assessments in a bid to capture the full context of individual and family situations. So in this case, families need more time. They need more attention to their individual needs. for services to be culturally appropriate to their needs. Thank you for listening, and I'm available to take any questions that may arise for you from this presentation. Thank you so much.